Welcome to the Study Skills Workshop. This workshop is designed to help nursing students prepare for exams. The information presented is a review of skills, techniques, and strategies nursing students can use to be better prepared to take an exam. We are going to start by looking at time management strategies. If you utilize effective time management skills, you can reduce testing anxiety, complete all required and desired tasks prior to the exam, and most importantly, learn the material. You will need to create a schedule in order to develop good time management habits. Once you create a schedule, stick to it. Here is an example of how you can organize your schedule. As you can see, time for class, studying, and home activities were all scheduled in this calendar. Whenever possible, delegate tasks. At home, you can have your significant other help with the dishes, laundry, and doing yard work. If you have children, assign them a task to complete each day, such as cleaning their room, unloading the dishwasher, and dusting the furniture. By delegating tasks, you can put your mind at ease that things at home will get done. Another effective time management strategy is to prioritize each task or activity you want to complete each day. Start with those you have identified as most important, and then if you have time in your day, work on the others that you have identified as not so important. Don't forget to schedule in time for yourself to relax. Scheduling this time will be sure you actually do it and will help to reduce anxiety and stress. Let's talk more about how to time manage when you are studying. You should never cram the night before an exam. Cramming is an ineffective way to study because it increases your anxiety and you are not able to concentrate on the concepts you are learning. The night before an exam should be spent on reviewing the information. Before you dive into the books, identify the material you know best and the material you know least. More time should be spent on reviewing material that you do not know, and then review the material you know well when you have time. Be sure to take breaks. Your brain and body need study breaks in order to keep learning. Study for about 2 hours and then take a 30-minute break. Now that we have looked at time management, let's look at some strategies that will help us on the day of the exam. Always remember to stay positive. Positive energy reduces stress and anxiety. When you get to your seat, do not listen to others around you. You may start to think you did not study enough information by listening to your classmates, which just increases your anxiety right before the exam. On the day of the exam, be sure to go to the bathroom before you sit down and do not drink caffeine before or during the examination. Caffeine decreases your ability to concentrate and also dehydrates you, which can cause you to have to use the restroom in the middle of the exam. When taking the exam, do not spend too much time on one question. If you are confused by the question or not sure of the answer, circle it and then come back to it if you have time. Be sure to mark on your test and Scantron, so if you miss a question on the Scantron, you can go back and mark the answer you selected. Here are a few things you should remember when taking a test. Start with reading the question first. Highlight or underline the key words in the question. Be sure to identify what the question is asking. Hint: it is helpful to cover up the answer choices so you are not tempted to read them. After you understand the question, then read through all the answer choices first. Then, mark through those that you know are wrong. Next, reread the question and the remaining answer choices. Select the best answer for the question. If you get stuck, Circle the question and come back to it. Once you have selected an answer, do not erase and do not second guess yourself. Nursing exam questions typically ask you to prioritize the answer. Remember to always review the question and select the best answer for what is being asked in the question. When reading a question that asks you what is the most important, it is actually asking you to establish a priority. Typically, the answer is related to client safety or the needs of the patient. Ask yourself, if I did not do this, is the patient still safe? Look at what needs to be done first before the other answer choices. Remember, all the answer choices may be correct, but which one is correct for that question? Let's look at a sample question. The first step is to read the question first. Here is the question. The nurse is caring for a female client who was brought to the emergency department by the spouse. Based on client's injuries, the nurse suspects the client may have been physically abused. Which of the following actions would be the most appropriate for the nurse to take? Now take a moment to identify what the question is asking. The question is asking which action would be the most appropriate. Keep this in mind when we look at the answer choices. Here is the question and answer choices. We have read the question and understand what the question is asking. So now let's look at the answer choices. Remember, we need to read through each answer choice before selecting an answer or crossing off wrong answers. Let's read the answer choices. A. Question the client about the possibility of abuse when the spouse is not in the room. B. Explain to the client that the client will have to speak with a police officer to rule out the possibility of abuse. C. Explain to the spouse that the client's injuries appear to be the result of physical abuse. D. Ask the client and the spouse how long they have been married. Now that we have read the answer choices, do you immediately see any that are wrong? Remember, the question was asking what is the most appropriate action for the nurse to take. Keeping the question in mind, answer choice D is wrong, so we can cross it off. It would not be appropriate to ask the client how long the client has been married. Still keeping in mind the question, would it also be appropriate to go talk to the spouse about the suspected abuse? No, so we can cross off C as well. Now we only have two answer choices left. To choose between A and B, prioritize the answer. Which answer choice must happen first before the other? Can B happen before A? No, because the client has not even disclosed that there has been physical abuse with the spouse, so B is wrong as well. Circle A and then mark A on your Scantron. Now you know how to analyze a nursing exam question. Thank you for viewing the presentation on study skills. If you want additional help with time management and study skills, come in for a counseling appointment today or talk with your instructors.